So we're lying in this position. It can be very helpful for engaging the diaphragm. And basically our diaphragm breathing muscle is located just at the base of the thorax. Now you could start off, it's always important to have the knees bent and to be comfortable. And you could start off by just putting your hands either side of your lower ribs. And the objective here is that as you breathe in, that you're just gently feeling the tummy moving upwards and a little bit outwards. So as you breathe in, you're feeling the hands moving up and out, and as you breathe out, you're feeling the hands moving down and in. And it's to continue with that, and you can see automatically, when we lie in this position, there's a greater tendency to breathe with good recruitment of the diaphragm. So it can be very helpful to start off with this. If somebody has anxiety or panic disorder, I'll often ask them to go into this position to engage the diaphragm, that they get a better sense of breathing with good recruitment of the diaphragm, and this can have a calming effect on the mind. It also improves gas exchange, etc. So just as you're doing it, as you're breathing in, you're feeling your hands moving out. And as you breathe out, you're feeling your hands gently moving in. And it's keeping the chest movement to a minimum, maybe about 20% movement from the chest, 80% is driven by the diaphragm. So there's your exhalation there. And as you breathe in, you're feeling your hands gently move out. And as you breathe out, your hands are gently moving in. Now what we will do is just soften the breath a little bit, because when we are engaging the diaphragm, we don't want to be taking full big breaths, because then there's a risk of hyperventilation. And hyperventilation means that we are breathing too much air. So we want to have a balance between breathing nose, breathing light, breathing slow, breathing low. So now as you're doing it, and as you're gently breathing in, the hands are moving upwards. And as you breathe out now, your hands are gently falling. And as you breathe in, your hands are gently rising upwards. And as you breathe out, your hands are gently falling. So we'll continue this for about a minute or so. And as you breathe in, your hands are gently rising up, and then as you breathe out, your hands are gently falling. Now, another way to do it might be using a book, for example. So if I just give you this book here, and if you place it, so you're placing it just above your navel, and as you breathe in, you're gently guiding the book upwards. And as you breathe out, the book is gently falling. And sometimes it might be easier with the book, and it's not about pushing and pulling the tummy. It's just about, as you breathe in, you're gently guiding the book upwards. And as you breathe out, so there's your breath coming in there, the book is gently rising up. And as you breathe out, now the book is gently falling. And as you breathe in, the book is gently rising. And as you breathe out, the book is gently falling. Now what we're going to do is we're actually going to slow down your breathing. So I'll have you breathe in for about 5 seconds and out for 5 seconds. Now, it won't be, it's a count of 5, it may not be perfectly 5 seconds. It doesn't matter. I'm working more with slow breathing and with rhythmic breathing. So you're breathing in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5. Okay, so you can take a rest at that. So the whole idea is to breathe nose and to breathe low. The last routine there, we brought in slow. So we slowed down the respiratory rate to 6 breaths per minute by breathing in for 5 seconds and by breathing out for 5 seconds. Prior to that, we were breathing nose, low, and light. So light breathing is when you're gently allowing your breathing to soften, because you can still breathe deeply with good recruitment of the diaphragm, because that ultimately is what a deep breath is, and breathe light at the same time. We don't have to fill our lungs with the risk of hyperventilation to engage good recruitment of the diaphragm. So excellent, that's the lying down with knees bent exercise to help engage good recruitment of the diaphragm, because it's much easier to do it in this position than it is, for example, sitting up. Or even standing up, it's quite possible too, but this can be a great position just to start bringing some awareness to the diaphragm.